Hello, my name is Clare. I'm a heart failure specialist nurse, and today I'm with my patient Alex, and we are going to be talking about heart failure and reflecting on Alex's journey from diagnosis to where we are today. Could you introduce yourself, Alex, and tell us a bit about how you come to be here today?
Hi Claire, my name's Alex. I'm 42 years old. In November of 2024 I was diagnosed with heart failure. It was a little bit of a shock, obviously. It's quite a scary diagnosis to receive, but not knowing much about it, I thought my world was ending. But Claire has obviously been my nurse for the last 8 months, and it's been a long journey. It's been a hard journey, but come back out the other side with a lot of positives, and I've made a lot of progress. So yeah.
Great. Can you tell us a bit about what happened to you to get that diagnosis? How you found out that your heart was impaired?
Yeah, sure. I'd been to the doctors previously for a persistent cough, and as a result, the doctor sent me for some chest X-rays and some blood tests. Got the results of the chest X-ray back. Saw some things I didn't quite understand. I was a little bit scared of, so I went to see my GP. GP had already been monitoring me for high blood pressure. She came back and said, yeah, we'll put you on some medication for the high blood pressure. Take it the following day with breakfast. So I went home, carried about my day, ended up coming over very, very dizzy and feeling sick and faint. And after a couple of calls back and forth to NHS 111 and the 999, a ambulance was sent to my house. I ended up in the local hospital, being investigated for the cause of the dizziness. As a result of that, I was sent for various follow-up scans and tests, one of which was an echocardiogram, and that picked up that I had impaired function on my left side of my heart. I found out about this on my 42nd birthday. So it was a real shock to the system. But as Claire obviously then spoke to me about it and explained what heart failure meant, because initially I'd thought that my heart was going to give up, which was probably the scariest thought, because it was just unknown, and I did lots of googling about various things and bits and pieces, and it was very, very scary. But Claire sort of really did put me at ease in our first meeting, and explained what the term heart failure actually meant and enabled me to see it in a completely different light.
It is difficult. It is a frightening diagnosis, and it's such an old-fashioned term, heart failure, isn't it?
Yeah.
And it does sound frightening. But it is important to remember, one, yes, it is an important diagnosis, but two, it's more easily understood. It's where your heart fails to pump effectively to meet your body's demands. And when this happens, it often results in shortness of breath, fatigue or fluid retention, and it can be the result of lots of things. It may be a previous heart attack or coronary heart disease, in your case high blood pressure. Some people have narrow or leaking heart valves, an irregular heartbeat, and then for some it could be infection, or at times lifestyle choices like excessive alcohol. Like we say, in your case, we're thinking it was due to your high blood pressure, and actually your scan of your heart showed that the left side of the heart, the left ventricle, was working about 24%. They call that your left ventricular ejection fraction. And that is an important diagnosis, and on the spectrum it was on the more severe end. But you're here today discussing this and the positivity of your journey and where we've ended up today. So just going back to that, our first appointment and our first meeting in the Community Heart Failure Service, when we met for the first time and we went through how you were feeling in your diagnosis, what sort of symptoms were you experiencing?
I think looking back, a lot of the symptoms, it was sort of joining the dots together and made a lot of sense. I mean, I was getting very breathless walking upstairs. My parents had said I'd looked like I put on a lot of weight recently, and I was a little bit in denial. So I was in my 40s. I thought, like most people do at a younger age, I'm invincible. It won't happen to me. Yeah. I was having problems sleeping sometimes. I'd wake up very breathless, but that used to come and go. That wasn't all the time. So it sort of crept up on me a little bit as well. So it wasn't a short, sharp shock. It was thinking about it over time. It was creeping up, and I just didn't join the dots together because I just didn't know. I thought it might have just been because I was a little bit overweight or a little bit unfit. But little did I know that this was happening inside me. And I think if I hadn't been to the doctors because of a persistent cough, which also Claire explained to me in our first meeting was another one of the symptoms, I don't think I would have. I might have still just carried on and tried to live with the symptoms and manage them day to day.
I think that's the issue, because lots of people have those atypical symptoms. They just put it down to maybe being deconditioned, a little bit overweight, or just down to their other health problems. But like I say, it is important. The focus when you come into the Community Heart Failure Service was you knew you had this diagnosis, and it was about taking stock and making a plan so that you could manage this long-term condition, heart failure. And we did that through the information we gave you. There was an e-learn platform, and through patient education. You spent some time with our patient educator. Did you find that helpful?
Yeah, I did find it helpful actually, because it explained sort of a lot of the issues and how you can sort of combat them, sort of some lifestyle choices and changes, sort of things like diet, exercise, and also the role of all the medication, the various medications that you're prescribed, depending on the diagnosis and the severity.
One of the key things that we ask our patients to do is to monitor themselves and pick up on any red flags that may suspect us to be concerned with their symptoms. So one of those things can be weighing yourself daily, as you know, monitoring your blood pressure, and just reviewing your fluid intake, looking at your ankles to see if they're swollen. What's your sleeping habits like? Are you sleeping as normal? Like you said when you first presented, that you were waking up at night short of breath. It was those things that we wanted you to be aware of and to flag if we had any concerns. We gave you telehealth monitoring. How did you find telehealth? I
found that quite, because I say from my background in IT, doing the submitting the readings on an electronic device, it was sort of second nature to me. It already became part of my routine. Morning routine would be sort of weigh, take my blood pressure, take my medication, and then I go about my day basically. So it was, the monitoring wasn't an issue for me. I built it into a routine, so I knew I had my process in the morning for various things. So yeah, no, it wasn't, the daily monitoring wasn't a problem, and it helped me to sort of keep track of my progress, because one of the things I did do from very early on from my diagnosis was I was very sedentary. I used to sit down a lot for work. I didn't do much exercise. So I thought, what's the easiest thing I can do? I just went out, I would get up at lunchtime during the day, and I'd go for a walk. I'd go for about 1.5 mile walk through our village and back, and that was manageable. And again, it's become part of my routine. I still do it now, and I do it when I'm in the office as well. I go for a walk around the local area when I'm in the office, and unless the weather precludes from that, I try and go out first thing before I even have any lunch or anything like that. So it's all become a routine to me. So, and I think that helped me to sort of keep on top of things, basically do the same thing at the same time every day.
Yeah, it's good to have that structure, isn't it? And especially when you're facing, the changes. Like, for example, the medication. We put all our patients on the 4 pillars of heart failure therapy, which we've done with yourself. How did you find the medications and the monitoring of the blood tests and just coming for appointments?
So I'm quite lucky. I'm not too fussed about needles or anything like that. So the blood tests didn't pose a problem to me or anything like that. I think at one point I was having them every sort of 4 or 5 weeks. So it was quite a lot. I've probably given quite a lot of blood compared to most people my age for various things. But I understand obviously its role in sort of keeping track of the effects of the various medications that I'm taking. Medication wise, I haven't had any problems with the various doses of the various medication. The only one I did have problems with as such was the blood pressure medication I was on. My blood pressure was, when I first started on it, it took my blood pressure very low. Yeah. So I was getting dizzy spells when I'd stand up. So I sort of have to sort of stand up, I go a little bit dizzy, and I sort of have to sort of pause and be conscious of not walking off straight away. So sort of wait for my equilibrium to sort of return before continuing and things like that. So no real issues with medication. When I was put on the final of the 4 pillars of the medication, as Claire mentioned, I had a bit of a reaction to a slightly higher dose of it, but we're thinking, looking back on that, it was maybe a coincidence rather than a side effect. We've now increased the dose, although I split it across the day rather than all in one go.
Yeah, you did well with staggering your medications throughout the day. It made you tolerate them easier, didn't it? So, and then after we'd optimised your medications and you were improving in your symptoms, you were feeling so much better, you'd had a cardiac MRI scan, which we have the results back, and your heart function had improved. In fact, your ejection fraction improved to 43%. As you know, I phoned you at work to tell you about this. How did that make you feel?
Well, initially I had a phone call from Claire very early in the morning. I think it might have been about 8:30 or something like that in the morning, completely unexpected out of the blue. So I thought, what could this be? So I took myself off into a meeting room for a little bit of privacy, because I didn't know what the news, what the content of the call was. And Claire basically gave me the good news that we'd finally had the results back from the MRI, because I had to travel down to Bristol for it. So there was a lot of waiting whilst the results were reported back to my consultant in Gloucester and then to Claire. But I think the one word I was described was relief. It felt like a weight had been really lifted off my shoulders, because we talked about not only a couple of weeks before, we talked about sort of the long-term prognosis and treatment plan for depending on what the results of the MRI were, and we just didn't know at that stage, so we didn't go into too much detail, but it was a real weight off my shoulders, I think, having that telephone call. I mean, I were not ashamed to admit it, but I actually cried, and throughout this diagnosis in general, I'm not ashamed to say it, there were a lot of tears. There was a lot of scary moments, but that was, I think, when I got that news, it was almost a turning point, I think. I mean, I've made a lot of good progress anyway, and I felt so much better in myself in the months preceding that I think it was just sort of the icing on the cake, I think. Yeah. And it showed that the hard work had paid off.
Yeah. I think that's true, because obviously it was quite overwhelming. We weren't sure whether you needed a device such as a ICD, a defibrillator that you may need because of the severity of your heart failure. And getting that news just puts you outside of the remit of needing that, and just to move forward. I think it's fair to say that, on your journey, you're on all the right medications, your heart function's improved, but more importantly, you feel so much different. You've recently been camping with your son.
Yes.
And you were really active, which is amazing. Can you just share with us your coastal walk and experience?
So we tried to go camping down to Weymouth in Dorset every year. We picked a good week this year to do it. We had brilliant weather. I think it was like 30 degrees on most days. And we decided one day, we went to Durdle Door, which is a World Heritage Site not far from Weymouth. So I'd never been there before. So we come to this cliff top, and we know there's a beach at the bottom of the hill. So we start the walk down, and I didn't realise quite how steep it was down there. And one of the things one of my symptoms pre-diagnosis was I'd get very much out of breath, sometimes even walking downhill. But walking downhill and then back up the hill from the beach was absolutely fine. Didn't struggle at all, just paced it quite nicely because it was quite busy as well, which helped. And then we decided we were going to walk to Lulworth Cove, which is just a little bit further along the coastal path. And we got to the top of the hill, down into Lulworth, and looked, and I thought, oh my God, that is really steep. But we continued downhill, and then my little boy said, have we got to go back up that hill, Daddy? And I was like, yes, Jack, we do. So we looked at this hill, and I thought I was going to struggle. It was 30 degrees, blazing sun, had a small bottle of water with us, and that was about it, which we hadn't gone very well prepared for that particular leg of our journey. If anything, we did have to stop on the way back up, but it was for a rather theatrical 13-year-old boy saying he was out of breath and panting. And thinking back, I actually it didn't affect me or didn't bother me in the slightest, which I was very, very pleasantly surprised about, considering not only sort of maybe 8 months ago I would have really struggled. So that was, I think, another indicator to me of actually how far I had come.
Yeah, it's great, isn't it? It's amazing. Do you think some of the tools that you'd learned on the heart failure rehabilitation programme had enabled you to pace yourself and to be able to do that level of activity?
Yes, I think it did actually, because I knew just to sort of to pace it. It's a very steep hill coming up out of Lulworth back to the top of the hill to Durdle Door, but we were lucky that it was stepped in a way. It wasn't continuous steps, but there were lots of very long steps, so we could sort of we paced it and we'd stop every sort of like three or four cycles of step, just to sort of acclimatise and sort of get a bit of a breather and have a drink, and then we carry on for the next lot. And before we knew it, we were there back at the top, and it was fine. So yeah, so it was, again, I think I was pleasantly surprised at how well I had managed that hill, considering how bad, looking back on how bad my symptoms actually were without realising it.
I think you've done amazingly well. The only thing outstanding in your treatment plan with your cardiologist is you've just had some genetic testing which you're awaiting the results of. Any concerns regarding that? No,
I say it would be, because at the moment it's only a sort of a supposition that my high blood pressure caused it, it would be good, I think, to not only for me to sort of, for my peace of mind, to find out whether I was genetically predisposed to it, or whether it was just a combination of lifestyle and it sort of just crept up on me. So I think for my own peace of mind, certainly I think it was, that's why I decided to go for the testing, and also for my 13-year-old son as well, so that if there is a genetic cause for it, he can then be tested at an appropriate time, and as he gets older, he's a little bit more aware of the signs and the symptoms, and you can sort of look to make changes earlier rather than when the chips are down, so to speak, when you are in a crisis situation, which is what I found myself in.
Yeah, that's true. I suppose that now, Alex, really looking towards the future and the what next and the next steps for you, what do you have planned?
I think just to continue living my life as I am at the moment. I haven't let it sort of impact me too much. I had to sort of curtail some hobbies for the time being, but I've recently got back into those, so I'm really pleased with that, because my friends were constantly nagging me, when are you coming back, when are you going to be allowed to do this, when are you going to be allowed to do that, and one of the things I will take on is the lifestyle changes. I will continue to go for my walk. I am a lot more cautious of what I eat, because again, I thought at my age I thought I was invincible, but it turned out to be not the case. It was a very sobering diagnosis, but I've taken away a lot of positive changes, and yeah, I think I'm just going to continue living my life and incorporating those positive changes into what I do going forward.
I think that's excellent, and look where you are today. Just very lastly, just for other patients that are about at the start of this journey, what advice would you give to them that are facing what you've just faced in the last 8 months?
I think there's a couple of things I'd pass on as advice. I said, if something doesn't feel right, go and see your GP. I put off going to the GP because of the cough for probably about 3 or 4 months, because I thought it was just it came and went, and I thought, I'm okay, I'm young, I'm fairly healthy. I think I knew deep down as well that I needed to lose a bit of weight, but it was not the way I'd have chosen to do it, but I am where I am today. But yes, basically I'd say, if something doesn't feel right, go and see a GP. My GP was absolutely brilliant, got me on the right track. Clare has been with me for about 8 months, I think it is now. I've had my appointments with Clare, and she's been there supporting me all the way, sort of listening to me, listening to my concerns and my worries, obviously fighting my corner as well, because we were waiting a long time for some of the results to come back, and I remember one conversation Claire said, if I haven't heard anything by Monday, I'm going to be going down there myself to find out what's going on. So I say, to have someone like Claire championing my cause was absolutely fantastic. And I think one of the things I said to my friend at work when I was in hospital in the very early days, I said, God bless the NHS, they've been absolutely fantastic for me throughout all of this. It's been fantastic.
That's great, thanks Alex. And if this can help anyone else facing this journey and they get some help, some insight and some reassurance from this, it'd be great. So thanks ever so much for talking to me.
No, thank you, Claire.